Welcome to Medspectives, the podcast about health professionals, the stories of their practice, and the diverse perspectives into the world around us. I'm your host, Arvind Rajan. On today's episode, we're joined by Rhianna Ferial, a nurse anesthetist. I find Rhianna's story particularly interesting because she's not only dedicated to helping her patients, but runs a YouTube channel with over 30,000 subscribers, where she makes videos sharing her experiences. She covers every part of the career and is an inspiration for anyone considering a career in medicine. We talk about the basics of anesthesia and the high levels of accountability that are required in this field, as well as her experiences in nursing from her time working in the ICU as a travel nurse and currently as a nurse anesthetist, complete with stories from her practice. I hope you enjoy, and if you like this conversation, please drop a like, share, and subscribe. You can also find us anywhere you get your podcasts. On with the episode. Today we're joined by Rhianna Ferial. Rhianna Ferial is a nurse anesthetist. How are you doing today?
I'm doing good. I just got off work, so it's been a good day so far. It's so nice out here.
That's awesome. And thank you so much for your time today. I'm really excited to have this conversation with you and talk about anesthesia and all the other experiences you have in general as well. But I kind of just want to start off just with your journey through medicine, right? Like, when did you know that you wanted to go into medicine? Was there any particular moment, or just it was something that you always knew? Or
Yeah, I always knew I wanted to be a nurse, not specifically in anesthesia, but I feel like ever since I was younger, there wasn't a huge story of a moment that made me want to be a nurse. That's just kind of always what I wanted to do ever since I was little. And so I got into nursing, it just kind of happened. I did EMT in high school because that was kind of the closest thing I could get. And then I went to nursing school. And when I had started nursing school, I didn't even know about nurse anesthetist. So I just wanted to be a nurse. And that was my main goal in the beginning.
Right. Yeah. And I think, especially because at my school right here, nursing is such a difficult program, especially in the beginning, those classes, just GPA wise, you need to get a 97 plus or something, an A, I don't know exactly, but it's very, very competitive. And so how was that? How was the schooling part of it?
Yeah, when I went to nursing school, our grading scale was pretty competitive. A 93 was an A. And then to get into CRNA school, I knew I had to do well in nursing school. When I figured out that I wanted to be a CRNA, I was already halfway through. So in CRNA school though, a 94 to 100 is an A, an 88 to 93 is a B, and anything below that you don't pass.
Wow.
So if you get under it, if you get 87 or below, it's considered a C, but you're not allowed to have C's. So it's a big issue.
Right. And a lot of people are asking because, grades are very important, but also like you were saying, you need the experience as well as working too. And so how do you do that? How do you balance having to get this experience and on top of that maintain these really high grades?
Yeah, I feel you just have to prioritize and manage your time well. So when I was in nursing school, I became a tech in the hospital I wanted to work in because I wanted to work in level 1 trauma center as a new grad, and it can be hard to get a job as a new grad in ICU in a big hospital. So I became a tech there on the weekends, and then during the week I focused just on school. And I feel that it was hard, and I didn't get all A's during nursing school, but I feel my experience made up for me not having a 4.0 because I could explain I was getting experience that was going to help me long term.
Right. And how did you know you wanted to apply to CRNA school? Was there anything in particular that gravitated you towards that field?
Yes. So when I shadowed, we did OR rotations in nursing school. And when I went in the OR, I got there really early because it was at a different hospital I hadn't been to before, and I didn't want to get lost. So I was sitting out there, nobody was there. And then this guy walks in, this older guy, it was the anesthesiologist. And he was the first one there. And he said, what are you here for? And I think he thought I was a med student at first, but then I was I'm a nursing student, but I'm just in the OR today. And he said, why don't you come with me? And so I went with him the whole day. And then I was whoa, this is so awesome. And then he told me to go to CRNA school. He was oh, you could be a CRNA, you can still do this. And ever since then, that was my plan.
That's awesome. And so this was while you were getting your BSN, or?
I got my associate's degree in nursing first. So okay. It was while I was getting my associate's degree. And then when I started working in ICU, I did a associate's to bachelor's program.
Gotcha. Okay.
Yeah.
And with anesthesia in general, we all know, you go to the doctor and they put you you go unconscious for a little while, and then, surgery happens and then it's over. But, what are the different types of anesthesia that you do? Because I think like in general, that's kind of what we assume. And I know
Yeah.
you were talking about like, especially towards the future, we're moving towards like not using opioids in anesthesia and things like that. So it's a lot of cool stuff. Like, what are the different types?
Yeah, I actually did opioid-free anesthesia all day today. So this is a
Okay.
good question. So there's really like a couple main types of anesthesia, and then there's like subtypes of all that. So mainly you have general anesthesia, which means you're all the way asleep, unconscious, like have a breathing tube, like all the way. That's as deep as you can get. And then you have MAC anesthesia, which we call twilight anesthesia, and that's like if you go to get a colonoscopy or something and they put you to sleep, but they keep you breathing and you don't have a breathing tube and I'm trying to talk simply for like everybody who's
Right.
watching. And you're like still kind of maintaining your own breathing and vital signs. And then there's regional anesthesia, which is like nerve blocks, like epidurals when you're having a baby, or spinals for a C-section, a block of your arm where they block the nerves here so you can get surgery on your hand. And that is a whole other one. And then you can kind of blend them all together. So you can have a general with a regional component. So it's actually really cool.
Right. And I was looking at one of your posts, I think, and you had like 4 or 5 different drugs like for just one procedure, right? Like for like administering anesthesia. So like how how does that work? Like most of the time, are you using multiple drugs like to deliver a certain type of anesthesia?
Yeah, we use a lot of different drugs. Drugs can have like additive effects where if you use like 3 different kinds that work on a little bit different receptors, then you use them all together. It just has this big effect. So what we usually use to keep people asleep during a general anesthetic is it's called a volatile anesthetic, but it's gas you breathe in. So that's how we
Mm,
usually keep people to sleep. We usually put people to sleep with propofol, which most everybody knows what that is now. And
right.
then we use opioids or like non-opioid analgesics if we're trying to avoid opioids. So like today I use some drugs called like ketamine, which a lot of people know what ketamine is,
Right.
Presidex, magnesium, which is something that's already in your body, and then lidocaine. So those are it's
Right.
just an example of a few drugs we use, but there's so much different stuff you can do.
Right. And I think that's exciting. Like I think drugs like ketamine, I'm a basic like locally like EMT basic, and they're trying to, bring ketamine to be more used in procedures and things like that because, like you said, it's opioid free. But of course, like in the beginning, there's always the kind of controversy or it's not as supported as you'd hope it would be. And it's really exciting to move towards that future where we're like trying new drugs that aren't having the issues that previous ones are having.
Yeah, it's really nice. And ketamine's good thing about it is you can keep people breathing easier than with like using an opioid or with propofol. And unless you're doing a very high dose, you don't usually have like the hallucinogenic effects, which you don't want when you're doing something for medicine. So
Right.
yeah, usually if you keep a pretty controlled dose, you don't have those issues.
Right. And when you're doing these kind of procedures and anesthesia, how is the pressure like? Because I know, especially with anesthesia, like it's a lot of accountability because,
Mhm.
it's very easy, I feel like, to mess something up if, a dosage is wrong or anything. So how do you manage that kind of stress and do the right thing every time?
Yeah, it's definitely comes with time and learning and experience. Our program was so intensive that now that I've graduated and I'm working on my own, I felt like very well prepared. So we have so much clinical in our program, like over 2,000 hours of clinical time in the OR, and that is the time you use to like make mistakes or almost make mistakes, and then whoever you're with will make it a teaching moment and tell you what you're doing wrong. During that time, we're also doing our didactic studies, and when we're in school, we pre-plan on every patient. So we go the night before, look up all of our patients, and write out anesthesia plans. So now that I'm on my own, it's like second nature to me almost. Like I have been doing it for 3 years all the time. So now that I'm on my own, I have all the basics and everything, and even the advanced stuff. I feel like knowledge is how you kind of combat that stress and anxiety. The more you understand something, the less scary it is. So if I feel nervous about something, I'm doing a new surgery, I just go read about it. And if I understand everything and what could go wrong and what I'll do if something does go wrong, it's not as scary because I have a plan.
Right. What do you think is the hardest part of managing all of that, especially like in the beginning when you were learning?
In the beginning, it was the multitasking of a bunch of different stuff, which thankfully, because I've worked in ICU, I had that experience with the like critical high stress situations. So like going in the OR is more stressful because it's just my responsibility. In ICU, we had a whole team all the time. But I was used to it, like really sick people on a lot of medications, people who were like near death. So that wasn't anything new to me when I went into the OR. But I would say like the beginning, the hardest thing was learning how to take care of the patient, but also do documentation. So what I would do in the beginning is completely focus on the patient and then like document later, because you don't want to be taking time away from what you're doing to like chart. So I feel like, but now that I've had more experience and I'm faster at charting and stuff, it's a little more easy to do that.
Right. And in your field, how's the patient interaction aspect of it? Like how often are you interacting with the patient, and do you follow up with them after a procedure?
Yes. So I don't follow up with every patient. I work in an anesthesia care team model. So we work with anesthesiologists. And so usually the anesthesiologists follow the patients in PACU, and I go straight into another case. So it kind of keeps our workflow going. If I was working in a CRNA only practice, I would be doing the follow through and the discharge, but that is what the anesthesiologists do where I work. And pre-op, the anesthesiologist does a pre-op assessment, but I also do a pre-op assessment. So we like both talk to the patient, and sometimes we do it together to make it like so the patient's not answering a million questions. So I feel like the interaction is good. If you're looking for a job where you're going to interact with patients all day long, 24/7, that's probably not your route, because yes, the patient is asleep a lot of the time, but when they're going to sleep and waking up, I do have great interaction with them. Maybe like nurse practitioner, or if you're like in medicine, something like family med where the patients are awake more would be better. But yeah, I like it. And I like, like helping them through like pre-op is like the most anxiety provoking time for people. So I like helping them through and calming them down and getting them sleep and awake safely.
Right. And it was really interesting what you said. I think I was watching one of your YouTube videos. I think it was about like why you didn't want to go to medical school, or you chose to do nursing instead. And I think that was the main thing you mentioned, like having that extended patient interaction. And so like, is that something that you hold very valuable?
Yeah, I really appreciated that, especially during my like ICU days. And before ICU, I worked in oncology as a tech. So that was like, we really got to know our patients there because they were there for a really long time. And even now, if my patients goes inpatient after their surgery, like the next day they're in the ICU or something, I'll go see them and see how it's going and things like that. Same day surgery, they go home like right after surgery. I don't usually see them afterwards, but yeah, I really appreciate patient interaction, but more than just like the quantity of it, I appreciate the quality of it, because while I don't get patient interaction my whole day, when I do, I feel like it's important.
What is something that you wish people knew about your job that isn't, well known?
Yeah, that's a hard question to answer because there's so much, but
Yeah.
I think that people don't understand what anesthesia is or what we do. So they think that we like give them something, put them to sleep and leave, and then the surgeon does everything. So what I always explain to people when I introduce myself is I always say, like, my name's Rhianna, I'm the nurse anesthetist. I'll be with you the entire surgery. And they're like, oh, you will? And I'm like, yes, I'll be right at your head, giving you all your medications, keeping you comfortable while like Dr. So-and-so does your surgery and gets you fixed up. And they're like, oh, I didn't know you'd be there the whole time. Like they thought we just put them to sleep and just head on out.
Left, yeah.
Yeah. So, yeah, I think that just knowing that while the surgeon's doing their surgery, the anesthesia team is keeping them asleep and safe. And that might help people feel a little better.
Yeah, to make them feel more comfortable, like you were
Yeah.
saying, the preoperative period is like very, very stressful for them. So
Yeah.
cool. And what ways do you think that your job is really rewarding in that sense?
I feel like my job is rewarding in the sense that we get to help people get better. And while this is not all the time, I do work in a trauma center. So a lot of times like people are coming in like after a big trauma, a massive stroke, something like that. But our goal is to get them better. The kind of the same as ICU. So we're providing their anesthesia so the surgeons can work on whatever part of their body system needs to be fixed. And also keeping them safe and pain-free after surgery and free of like complications. Nausea, vomiting is really common after surgery. I feel like it's just so rewarding when somebody goes in, gets like their knee fixed that's been bothering them for years, and then they wake up and they're not sick, they're not in pain, and then they go home and they have a new knee. Like something like that is so nice.
When I had a conversation with Nurse Al, he was talking about like how, when patients like come back and then, they send you a note or, some kind of appreciation, like, do you have things like that? You think that like you hold dear to yourself?
I ran into the biggest like memory I have is that I ran into I ran to a patient in a restaurant that I had taken care of, and she told her whole table that I saved her life, and was like, that's my nurse. Like, and it was like I was like a little embarrassed because I was like, oh, like it was like a lot of attention, but I was like, oh, that was like so nice because she's doing well. Like she walked in the restaurant, was eating with her friends or her family, whoever it was, and she was like, she remembered me, and I thought that was like super rewarding, and it was just like, oh, interesting experience because I never had that before.
Right, she's just living her normal life now.
Yeah,
because of what you did. That's awesome.
Yeah.
I think on Medspectives, we also like to focus, on stories like these and individual interactions you're having with patients. Are there any that kind of stick out to you? Any cases that you've had, whether it be, your time doing ICU or travel nursing or as a CRNA? Is there anything that you hold really close to you?
Yeah, I've had a lot of like like I'm going through like so many scenarios in my head right now because there's so many that are like important or meaningful. But I would say like one of the things I learned early on was from a situation. I had a patient who had leukemia, and she had like she was having like when you have leukemia, sometimes you get like a thing called a stem cell transplant or something, and you can end up having like horrible like diarrhea. So anyway, she was confused, had like all these problems, and her wedding ring in her band she would never take off. She had like a big huge ring, and it had gotten like so dirty from just being in bed and having all this stuff going on, like blood. So she was like sad that it was dirty, so I took it and cleaned it with like a toothbrush and toothpaste out of the supply room, and she was like so excited, like this was her new ring again. And I didn't think it was that big of a deal when it happened, but her husband talked about it for like a week, and they wrote me a note about it and everything. Wow. And like, then that made me realize, because that was when I was very new, that like little tiny things that we do have a huge impact on the patients. And it's something that could almost seem like it wouldn't be that important because that's not going to hurt her or like save her life, but it really did like make a difference.
Yeah. It's kind of like that, they come to the hospital to get help through whatever their condition is, but at the same time, like it's still, a human interaction, and any gesture like that means like a lot.
Yeah.
That's amazing. Through your time in travel nursing, how is that period of time? I know you're talking about you traveled a lot and it was a lot of fun. Were there any cases that stood out to you there?
Yeah, travel nursing was awesome. First of all, like I'm so glad that I did that and delayed school a bit. And I would have kept traveling if I wasn't going to CRNA school. It was hard to stop. But I think that the biggest things when I was travel nursing was when I would, maybe not a specific case that I'll point out, but it was when I would go somewhere and either I did something different than how they did it, or they did it different than me, and we would teach each other, kind of. Like I would have experience with something that maybe the nurses hadn't seen before, and I would like show them how we do it. Like I was on a unit one time that got a swan catheter or a pulmonary artery catheter, and they had never seen one before. None of them had. And it was like a small hospital, and that patient should have been shipped out, but the hospital was full. So I like showed all the nurses how you use a PA catheter. And then on the flip side, I've had experiences where nurses in other hospitals taught me something that I didn't know, or taught me how to do a procedure that I hadn't done before. So I think when I was travel nursing, my experiences with other nurses and doctors that I didn't know and that were from a different kind of hospital, because all of them kind of run a little differently, was like super meaningful and impacted me, taught me a lot.
Right. And you always have something to learn from other people. And I guess every hospital has their own procedures. And so that's really interesting though. Like, so when you go to new hospitals, is there like a period of time where you have to be trained to like, their policies or things like that? Or is it just kind of universal?
It's not very universal, like in a general sense it is, but hospitals are very specific on like their own things. The charting's different in a lot of different hospitals and things like that. But it kind of, you go and you do some like classroom stuff for like a day or two, and then they just like throw you in and give you patients. So you have to really know what you're doing when you go traveling, because they're usually hiring you because they're understaffed, which means they don't have the staff to train you usually.
Right.
So they'll be like, here's the supply room, here's this, like, can you take these patients, like, please? So I felt like it was like that. And I came from like a big hospital. That was my experience before. So it was okay. But my first assignment, I was like, whoa, this is real. Like,
Right. And I
it's
guess
got
like
real now.
being in ICU medicine, like you're used to getting kind of thrown in situations and just kind of having to adapt.
Yeah. The hardest thing that ever, honestly, this is the hardest thing that ever happened to me when I was travel nursing was I got floated to med surg. And like, if there's med surg nurses watching this, so much respect, because that is one of the hardest floors to work on, because they have like too many patients, lots of medications, and lots of patients that need help all the time. Whereas like in ICU, we just have two usually, and we can kind of focus back and forth. I got floated to med surg, never been out of the ICU before. I had like like 6 patients and was like all over the place. Like it was really, I was like, wow, this is so much harder than I thought. And I think that was probably the hardest night I ever had as a travel nurse.
Oh my goodness. So that's just like the medical
Medical
surgery?
surgical.
Okay.
Yeah, it's like a general floor that takes everything. So they have like
Oh,
post-op patients, they have like medical patients, diabetic patients, like wounds, like everything you can imagine. And like all these people need help at the same time, it seems like. And then there's only like a few nurses with all these people. It was hard.
right. And like, wow. Yeah, that's a whole nother level of stress. You have to manage so
Yeah.
many people. Being an ICU nurse was more stressful, or did you think that being a CRN or doing what you are doing now more stressful?
Okay, they were stressful and more stressful in different ways, and I'll explain really fast. So, an ICU nurse, that was very stressful because I didn't have the experience in critical care. And I was like literally just learning everything. Like, I was seeing people dying for like the first time. I was learning how to like give blood and do all this emergency stuff. Um, CRNA is more stressful because I'm the only person responsible. So like it's on me and I'm taking care of the patient, making the decisions and things like that. If there's an emergency, I have to fix it. I don't have like 5 doctors and nurses coming running to help me. So I feel like the critical care experience really helped me like become the CRNA that I am. But I'm also still learning. I'm a new CRNA, so I'm always like consulting people I work with that have more experience if I'm worried about something or I have a question. And
Right.
yeah, it's just a different kind of stress, but just it's like I forgot the word I was trying to use, but like accountability, like you are
Right.
responsible, and people are like literally putting their lives in your hands. So
Yeah. I know like anesthesia is like, is there like a special type of insurance or something you need to get for like anesthesia? Because I've heard like, of course, like the pay is high, but then you have to pay like a high insurance or something. I'm not sure if that's just like a myth or.
it's kind of a myth. So the insurance, like it's relatively expensive, but it's not what you would think. So actually where I work, our hospital covers our malpractice. So I don't pay anything. And that's really nice because not everywhere does that for like nurse practitioners or CRNAs. But if I was to get it by myself, I got a quote for like a year, and it seems to be between like $4,000 and $6,000 for the year, which isn't that much compared to the pay
Right.
and to
Right.
protect yourself. So yes, you need malpractice insurance. And I guess it'd be the same for any kind of like physician. They all have like, I'm sure the surgeon's malpractice insurance is like pretty high. I'd be interested to know what that is, but
Right.
yeah, it's
I'm not
kind
sure.
of for everybody.
Gotcha. And I think it's really interesting because you're very transparent about like, anything like this, like especially like your YouTube channel, you put like all your experiences about the field, and it's really interesting, scrolling through the comments just to see like how much that transparency helps people, because these are the things that people need to know, because that's the realities of the field. Um, how did you start making YouTube videos, and what was kind of the decision of, how do you make the decision that you wanted to make them?
So I wanted to make them kind of for a long time. I like thought about it when I was travel nursing, but I was like very awkward and like too shy to record myself. Like I would try, I like take my phone and try to record, and I literally could not. And so anybody who's ever recorded themselves knows like how it's so weird and you have to get
Yeah.
used to it. And then when I started CRNA school, I was like, I'm going to make a YouTube channel. And I filmed an intro video and I like literally deleted it and was like, that was stupid. Not doing that again. And then one day I was just like, if I don't do it now, like I'm going to be all the way done with school and not be able to share like any of my experience, because that was my point in doing it. And so like at the end of my first year, I just like said, I'm filming a video on my phone today. And if it's horrible, I'm just going to post it and I don't care.
Yeah.
So I
No, I
filmed
remember you
my
said,
first
I think
vlog.
it's that first video you were like, I parked like in the middle of the parking lot. I see all my classmates walking by me.
Yeah.
That's awesome though. No, I think it's that first step that's always like the hardest.
It's hard at first because it's uncomfortable and it's like not the average thing that people are doing. And I was like, like I just felt so weird. But now I can talk to the camera and like walk around and I don't care. But yeah, I didn't tell anybody in my class or anything that I made a YouTube channel. And then one person found it and then everybody found out.
Right.
But they were all really nice. Like everybody was like, oh, that's cool, like supportive. So
Yeah, and I think because it is super helpful. Like, have you had like those interactions with people in the comments or any of your followers, like people that are using you as like a role model to carry out their goals because their goals are the same as yours.
yes, and that was like something that actually shocked me more. I didn't expect that as much. I wanted to like make videos to share because when I wanted to become a CRNA, there was like nothing. I couldn't find anything. And people, like I learned early on that people wanted to see more of like the whole picture, not just like me going to work and that's it. So then that's kind of when I started sharing our like more personal stuff. And I feel like people could relate a lot. And I like to share when I have struggles because it can seem like, especially on social media, that everybody's just doing great. And I just wanted to make sure that people know that like, even though I am becoming a CRNA, I still like have normal problems. And it took a long time to get here. So yeah, it's really like humbling whenever somebody calls me their role model, because I don't really see myself as like a role model, I
Mhm.
guess. And when people say that, I'm like, oh my goodness, like,
Yeah.
okay,
And it's
like
kind
I
of like a
guess,
motivation to keep making them too, right? Like
yeah, definitely.
that's awesome. Yeah, and because lots of people are like that I saw like they're talking about how they got into CRNA school, like using your advice, or how they're taking their exams or anything like that. So I mean, that's just I guess an amazing thing.
Yeah, it's been really nice. And I've also met a lot of other like awesome people on, like I met Al on social media. Not, I haven't even, I'm saying met, but I haven't met these people in real life yet.
Right.
But like there's a couple other CRNAs who like were vlogging when I was a student too. Like Nurse Nell, Aisha CRNA, and Bolt CRNA. And they were all ahead of me. So they all graduated before me and I was still in school. So they like kind of gave me advice and stuff. It felt like they were my virtual mentors. And yeah, I just met like a lot of cool people online that are into the same thing as me.
That's awesome. And what do you think your goals are with like the channel and in the future?
I didn't honestly think it would get this big or this far. Like when I started it, I thought like I was thinking small. Like I guess a lot of like successful people say that's a mistake, that you should always like think big. But yeah, I feel like it's just been like steadily growing. Not like anything crazy like how people blow up, but I feel like we made a really good community. And I don't really know what my long-term goals are. When I was in school, it was just to film and edit videos like when I had time, and it was kind of like survival mode. But now that I'm done with school, I have more time to think about things, and I'm not quite sure. I know I'll keep making videos, and
Yeah.
I would like to keep focusing on anesthesia, but also incorporate more life stuff and travel, hopefully, if we're ever allowed to travel again.
Right. Right. Yeah. I mean, I think like you said, like anything that you get out of the channel is just going back into the channel to,
Yeah.
push it further. And that's just so awesome. Like I think it's whenever I like find a new YouTube channel, I always go back to like the first video just to see like how far, someone's gone based off of like the support they've got and it's always amazing to see like, people not only get like super confident and it's also like people are just making all kinds of really really interesting content as it goes and that's just awesome.
Yeah. I love watching like people's journeys on YouTube. And so like, I feel like, when I watch people, I think of them like a YouTuber, but I don't think of myself like that because it's just me. So it's like just really, it's like a like a clarity moment when I realize that I also have a YouTube, and like a bunch of people are like looking to me for advice. So I'm like, oh, well, I do that same thing. Watch other people.
Yeah, I mean, everyone has their own role models. I think
Yeah.
that's really amazing. With that community in particular, like, have you had any interactions with people like in particular that, are really that really benefited from your videos or really benefited from your advice in particular?
Yeah. Like what comes to mind is I've actually had people that watched me on YouTube apply to the school I went to and come here. And I've met them like in the OR. I had like
Wow.
I had a student with me that I didn't, and he was like, I watch your videos. Like that's how I was like before I applied to school and stuff. And I was like, oh my, like I just felt like it felt so crazy. Like that was a crazy moment. And then I was in the elevator and a travel nurse, I ran into a travel nurse and she was like, are you Rhianna? And she was like, I watch all your videos. And she was from like another state. So
Yeah.
just things like that, like and also in my Instagram, a lot of people DM me on Instagram because they don't want to like share their GPA and all that like publicly. So I feel like I have really good conversations on Instagram with people who are trying to figure out what to do as well. But yeah, it's been fun, and I've had like a lot of good interactions.
That's awesome. That's really exciting, and it's just really interesting to see that you're motivating other people through your experiences too, right? Not only did you go through it, not only are you helping patients, but you're helping other people that also want to help patients, and that's just a really interesting interaction. And I think it's extremely valuable, and especially like with medicine, I feel like it's always felt as, or in the past, for example, has felt as kind of like a competitive thing where, you have to compete against people for applications. And I'm sure you felt this like, in nursing school with having to make such a high GPA. But I think we're moving towards a future where everything's collaborative, which is really exciting, right?
Yeah, I totally agree. Competitiveness in like the healthcare fields in general has been like a long time thing. And I made a video recently about CRNAs and AAs, which are like certified anesthesiologist assistants. I don't know if you're familiar with them, but like the career's not very well known. And it took me a little while to make that video, like time, because there's like a lot of kind of politics behind the scenes in a lot of different areas of medicine. And I was like I'm not here to like really be competitive. I'm here to like help patients and help people who are trying to figure out what career path to take, even if that's not the same one as me. So the same in school. We have that competitiveness even in CRNA school. Like we're at the like terminal degree and people are still super competitive, even though like it doesn't really matter if you get a 99 or 91 because you're all going to graduate.
Right, right.
Yeah, it was like that in CRNA school too.
Gotcha. I mean, it's just a universal thing, but I think, I think competitive, like compared to how it used to be, it's definitely getting a lot better. And
Yeah, there can be
um,
healthy competition, I think.
yeah, yeah, for
When you're
sure.
competing and like making each other better, I think that's
Yeah,
like an awesome, and that's like a fun, friendly competition. And I feel like that was like where we're headed.
right. It's exciting. Awesome. Well, thank you, Rihanna. Thank you so much for talking to us today.
Oh, no
Um,
problem.
I hope you enjoyed listening to our conversation, and thank you so much for listening. If you love Perspectives, be sure to follow us on Spotify, drop us a review on Apple Podcasts, and share this podcast with your friends. It really helps us grow, and I'd really appreciate it. Thank you so much, and I'll see you next Monday.